coming up on Bronco Tales.
The Boise State Department of Respiratory Care is the largest respiratory care department in the world. And really, the projected growth for respiratory care is 14 to 20% over the next 10 years.
Unbelievable resources to build one of the best ventilator labs in the country.
All right, everybody, welcome to another edition of Bronco Tales with the College of Health Sciences. Today we are focusing on respiratory care. My name is Daniel Lemus. I'm the Business Operations Manager for the Department of Respiratory Care, and it brings me great pleasure to be with Megan Koster, our Department Chair.
Hi, my name's Megan Koster, and as Daniel mentioned, I am the Chair here in Respiratory Care, and I also am the Director of our online Master's Degree program, and I'm super excited to be here.
And Camille Stover, our on-campus Program Director.
I'm Camille Stover. I'm our on-campus or our entry to practice program director here at our Boise State campus in Boise, Idaho.
What is a respiratory therapist?
Oh boy, we get that a lot.
Yeah.
That's probably our number one question is, what do you do?
And I wish after all of these years I had a better elevator speech about what it is that a respiratory care practitioner is. And I think it's so broad and diverse that you can't cover everything that we do. Yeah. And the expansion of our role over the last few years in, 20, 30-second blurb.
Yes. One of the things that I like to do with people who really have never heard about what we do is I say we're a specialty. So we specialize in the cardiopulmonary respiratory system. So in addition to dealing with the kidneys, anything having to do with the breathing that a person does or the cardiac function that a person does. And because those are so closely related to the kidneys, those are the three primary body systems that we deal with most. And I also like to say we're like a specialized lung practitioner, right? And I like to say we're one of the most important because if you're not breathing, you're really not doing much else. You know what I mean? So
Yep. I couldn't agree more. And, respiratory care practitioners can really work anywhere. And, in the last couple of years, we've worked to expand our role in where we really do work. We can see patients anywhere throughout the hospital. We're there when a patient arrives in the ER via ambulance or personal car. You can find us in ORs and, critical care units is a really large place that you'll see respiratory therapists. We work with newborn babies. We're in delivery rooms. We also work in the outpatient setting and with DMEs, so companies who provide patients with resources to be at home when they're critically ill or even need that CPAP or BiPAP machine for their home or for their sleep apnea.
Absolutely. I think that's a really good overview of what we do. And like Camille mentioned, it's really hard to say we do this one thing because again, Camille mentioned, we are everywhere in the hospital. And a lot of times we don't get the glaring spotlight on us because we are so busy solving problems. So my background is in neonatal and pediatrics, and I knew while I was still in school that that's the avenue that I wanted to go down. I can get into the reasons why, but I really, really enjoyed the autonomy that came with learning about etiology of newborn diseases, and then that led me into pediatrics as well. And there are specialty credentials that you can get depending on what avenue that you like to go in. One of the other areas that is infrequently mentioned is patient education. There are a lot of really chronic diseases. Lots of people probably have heard of COPD, pulmonary fibrosis. A lot of those chronic diseases that respiratory care providers are integral in doing the education for, and the outpatient, like Camille mentioned. And so even if you don't want to be in the hospital for your entire career, there are so many different avenues that you really can go into. Camille and I also found ourselves in higher ed. I couldn't have planned that. And if you had asked the younger me, would you ever be an instructor? I'd have said, absolutely not. Here I am. You know what I mean? So you can never say never. And what I tell people who are considering going what we call degree advancement in respiratory care, moving from one degree to the next, is why would I do that? I'm happy to talk about that. But one of the reasons I always say is education will never close a door to you. And you don't want to wait until that opportunity is in front of you to say, oh, I wish I had done this degree, or I wish I had, gotten this extra credential. That's not the time to be thinking about that.
Well, that's awesome. It sounds like there's a lot of opportunities as a respiratory therapist to work in hospitals, to work in private care, to work with all sorts of different age groups. So there's something out there for everybody. It sounds
Absolutely.
like.
That's a great way to put it, Daniel. There's something out there for everybody.
Cool. Well, I think if someone does decide to move into the respiratory therapy field, they probably do have some questions like, what career trajectories exist for me? It sounds like there really is no limit. It could go towards education. They might also be curious about, pay. That seems to be a very important topic. So maybe you guys could address some of those things when it comes to respiratory care.
Absolutely. That's another really broad range. And really the projected growth for respiratory care is expected, is it 14 to 20% over the next 10 years?
I think so.
And pay really is going to differ not only depending on the state that you're in, but also the role that you're fulfilling. Entry level is really, really hard. You can expect at least $60,000 to $70,000 as an entry to practice respiratory therapist with your, brand spanking new credential. And then depending on what institution you're in, whether or not they have a ladder or other incentives, you can expect to go up from there. Again, it'll also depend on the avenue that you're in. There are opportunities. If you're not sure what you want to do, you don't have roots, and you just want to get a lot of experience, there's opportunities to travel with travel companies. And usually you get a 13-week assignment. They pay for housing and other stuff, and you get to learn from some of the best places. They are usually paid very, very well in order to do that. So again, that's just another avenue, but it really is dependent on the institution that you're going to work in, the path that you're going to take. But it's definitely, what would you say, Camille? It's pretty much secure living.
Yeah, I think so. I also think you have to think about where you're going to be living.
Yes.
A student who starts as a new grad here in Boise is not going to make as much as a student who starts in San Francisco or in Seattle.
Right.
Interestingly enough, the AARC, the American Association for Respiratory Care, they're our national organization for respiratory care practitioners. They did a HR study in 2020, and obviously salaries have gone up quite a bit since 2020 because of how the environment of healthcare has changed in the last 3 years. But their median salary in 2020 was $60,000. With a max of 170. So there is opportunity to grow.
It's quite the range.
Exactly. And it just always depends. In healthcare, we also have to think about differentials. There's the opportunity to work night shift, which generally comes with an increased salary. There is, weekends and holidays. Those also make more. So, we can talk about, our students here in the Valley started about $30 an hour as a new grad. But that's not taking into account the extra shifts, the holiday differentials. So I think it's a comfortable salary.
Well, not to mention that some of the other places that you want to look into, in addition to salary, what other fringe benefits do they have? Right. So a lot of institutions, especially if you're lucky enough to hook up with a really large hospital system, will have things like tuition reimbursement or maybe tuition forgiveness, excellent healthcare packages. Like I mentioned, some of those ladders where the more you do, the more you're incentivized in terms of pay. So again, that is one thing I would tell anybody interested in respiratory care is look around you. Where do you want to be? And what opportunities exist within those institutions to help support your goals, whether they be financial or otherwise, to help get you where you want to be.
Well, that's awesome. So it sounds like, again, there's just a lot to take in there. I heard from 60,000 all the way to 170,000.
I know, what are the 170,000 people doing?
I don't know, but I'd like to figure out where that's at.
I didn't church up my resume a little bit.
Yeah.
Cool. Well, let's say that someone hears that 170,000 and they're like, all right, I'm going to be a respiratory therapist today. How does Boise State help people become respiratory therapists, or how does Boise State engage in the profession and the associations that exist within it?
Well, this is one of our favorite topics.
So in our on-campus program, which I'm the program director for, we prepare students to sit and take their licensure board exams. Our program is 2.5 years or 5 semesters. And during those 5 semesters, students learn what it takes to be a respiratory therapist. Students engage in clinical rotations for the entire time that they're in the program. They get about 700 clinical hours over those 5 semesters.
And I want to interject that those clinical hours per our accrediting body are actually in the hospital clinical hours. They're not simulation. They're not lab hours. They are direct patient contact hours, which is pretty impressive.
Yeah, especially given the size
of our
valley
Yeah.
and the clinical opportunities that our students have. Major shout out to our director of clinical education, Alyssa, who figures out where all of those students are going to go.
And our clinical partners
Yes.
who are amazing with our students.
Yes, who support the education of our students.
And for like a non-healthcare person, is clinical rotation, is that like an internship or?
That's a great point. Yeah, sometimes we use the lingo. When we say clinical environment, that's where students are not in the classroom or the laboratory here at Boise State. They're actually learning in a hospital environment. And again, Camille can explain more about this than I can. Go ahead.
Yeah, so our students go, during clinical rotations, our students are either paired up one-on-one with a staff therapist. So a respiratory care practitioner who's out in the hospital taking care of patients. It's an opportunity for students to see how these practitioners take care of patients, how we go through, how we provide our therapies, how we interact with patients and families. Or sometimes they're paired up with faculty or paid instructors. So during those rotations, they have a few more students per staff therapist, or I guess there are clinical instructors, and students get a little more hands-on time. They're a little less rushed because they don't have that full patient load, and we can take the time to talk about what it is that we're doing and the reasons behind it.
One of the things I love about the way Camille structured her program for entry to practice students is that our students hit the clinical environment 10 weeks into their first semester. So what she's really tried to do, in the entire on-campus program, faculty and staff have really tried to integrate those theoretical and laboratory experiences with actual real-world hands-on. So our students are able to apply what they're learning in the classroom or laboratory directly in the clinical environment, and vice versa. We have students come into the classroom all the time that's like, oh, you won't believe what I saw in clinical the other day. And they'll tell us about it, and we're like, you know what, that's a great segue into what we're going to learn. Let's go a little bit deeper into that. And so we find that ability to have students in clinical so early in their programming really does enrich their experience.
Awesome. So I heard 2.5 years to get through the program, some clinical experience that happens almost immediately, 700 hours to really feel comfortable in the field. And what else happens in that on-campus program to help support respiratory therapists?
So we teach students to be part of the interprofessional team. And with that goes, patient assessment skills. How do I listen to what a patient's lungs sound like? How do I figure out what is going on? How do I differentiate out the pieces to see through the noise? Students do labs 4 of the 5 semesters where they get to come into our labs, which I'm going to brag and say we have an incredible lab. We have had
I'm dancing.
Unbelievable resources to build one of the, in my opinion, best ventilator labs in the country. We have, and that's in part to our clinical partners and our wonderful donors. And so students get to learn on equipment that they see, maybe not necessarily here in the Valley, but if they were to go out across the country, they can see a variety of different therapeutic options and really get that hands-on opportunity to learn what it is that they're going to do out there.
And I love the fact that you mentioned that our students do go everywhere. So I think and correct me if I'm wrong, Camille, over the past at least 10 years, every student who has wanted a job in respiratory care has been able to find a job in respiratory care. And a lot of that has to do with our reputation as a program. So we are a nationally sought after program. We're one of the best in the nation. And so we've actually had people and institutional partners or clinical partners from outside of the Valley come to us and say, hey, we'd love for you to send students here. So one of the other unique things that students may take advantage of while in our program are remote clinicals. In addition to our amazing Treasure Valley supporters, we have relationships with institutions across the United States. And so that has really, really helped students say, wow, it's great to learn here, and I can learn over here, and I can take all of that with me, as a toolkit to be the most amazing provider after graduation that I can be.
Yeah, in our last graduating class, we had students go to Boston Children's, to Duke, to Vanderbilt, to Seattle Children's, UC Davis, to Mass Gen. And it's wonderful to see our students go out there, and sometimes they come back too.
And we love that.
Yep,
we absolutely love that. We joke actually. So within our department here, all of the entry to practice faculty are actually alumni of the Entry to Practice program. So we do really invest in those people who come back, and we love to have our alumni teaching with us. And lots of our adjuncts are also alumni, and then we just find our little Go Bronchi family, and we like to keep it close. And, once you're here, you're family.
Yeah, and we know what it's like to be a student in the program.
Yes.
And
we have not forgotten.
Yes.
How much you loved it.
We did love it. Yes.
I mean, I came back for a reason.
Oh, 100%. And I think that is, again, not to continue to pontificate about how amazing our program is, but guess what? It totally is. One of the reasons I think that our students are so successful is the culture that we have here at Boise State. Like I mentioned, and I joked a little bit, that once you're here, you're family. That is absolutely true. Camille and her team, and regardless of what program you're here at Boise State in respiratory care, once you're here, you really are family. The faculty and staff care so deeply about the development of the students. You're not just a number, right? So you're having a hard day in clinical, you saw something awful, which throughout COVID, our students saw some incredibly traumatic experiences. In order to help deal with that or help students deal with that, Camille and her team brought in counseling. Do you know what I mean? So we have a very close relationship with our students to make sure that we are preparing them in the best way possible. And that means in a holistic way. So yes, you will absolutely, after completing Camille's program, absolutely be able to pass your clinical board examinations. Not even a question, right? But you will also be very prepared to tackle anything that the workplace has to throw at you. You know what I mean? So I think, again, that's one thing that sets our program apart.
And we have small class sizes.
Yes.
It's much less intimidating to know 26 students' names in a classroom than, 300 or 80 or whatever it is, And I think that the small class sizes also lead to positive experience for the students as a peer group. They can really collaborate and get to know each other. And I think many of us who graduated from this program are still very close with many of our classmates. And because hard times bring people together.
Misery loves company. No, I'm just kidding.
Not the program's misery,
No, but those are trench times where you're like, oh my gosh, I'm taking 4 classes. I'm trying to work a job, or my kiddo is sick, or, I'm taking care of all of this. And we really do try to understand that. And because you move through this program in a cohort, and that means that you're taking the same classes on the same semesters as the people you started with, everything builds on itself. So the nice thing about that is you can circle back with your instructor, because I might have taught you the first semester and Alyssa or someone's going to teach you the second semester, but I'm still around, right? And so if you come back to me and say, hey, Megan, remember that thing that you told me in class, blah, 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 and I'm like, oh, yes, this is what I meant, and this is how you can connect the dots. So I think that's really, really amazing. The other thing that we really strive to do, because there are different entry points in respiratory care, so you can go to an associate level program, or a baccalaureate program, or even a master's to entry program, and sit for the same NBRC examinations. One of the things we do as a baccalaureate program is really try to build on just having those clinical skills, right? So like I mentioned, yes, you can absolutely pass those clinical board examinations, and you will have all of the bedside knowledge that you need to be an effective clinician, but you also have some of those advanced skills that a baccalaureate graduate will require. So those oral communication, those written communication, those really deep critical thinking skills really do set our students apart as baccalaureate level respiratory therapists.
Well, that's awesome. And I know that we could talk probably for a few more hours on how great the Entry to Practice on-campus program is.
Yes.
But I am aware that there are a few other programs in the department as well. So maybe we could do like a 2-minute plug on those, Megan.
Oh my gosh, only 2 minutes? I think I can do that. Absolutely. Well, one thing that a lot of people might know is actually the Boise State Department of Respiratory Care is the largest respiratory care department in the world. And part of the reason that is we have 3 distinct programs. We've talked a lot about Camille's Entry to Practice program that leads to licensure. As I also mentioned, there are a lot of associate level programs out there. And so in order for clinicians who are actively working, who already hold that RRT credential to advance to a baccalaureate degree, we have a really large online, what we call our RRT to BSRC program, or affectionately our degree advancement program, that is very, very large. And our director, Dr. TJ Wing, and some faculty and staff there really work hard to bring that culture of the on-campus program to the online setting. And so we're incredibly fortunate to have students from all over the United States and even other countries come to Boise State to finish their degree. In 2018, we looked at each other and said, man, what's the next step for Boise State in education? People look to us to be trailblazers in the education world for respiratory care. So we said, what do we do next? So we started a master's program. And one of the things that we did, we wanted to make sure that we were catering to respiratory therapists who were working, right? So we know that people in this program are going to be working professionals, working 40 plus hours. They might have familial obligations or other obligations. We need to make this a doable program in order to push the profession forward. So Dr. Joe Coyle and I developed the master's program specifically for working respiratory therapists to give them that, again, advanced knowledge they need to go to a different level of respiratory care. And so the cool thing about our masters, again, a little plug here, is we have 40% of our classes are advanced bedside management classes. The other 60% are split between both education and leadership. So again, we really tried to do this holistic umbrella of degree advancement, because in respiratory care, you may not know what you're going to do with the degree. And we want people to be able to use this degree no matter what opportunity presents itself. So here at Boise State, we have created a total trajectory for students in respiratory care to continue or advance their degree to be the best clinician they can be and propel the profession forward.
Well, I think
did I nail it in 2 minutes?
Yeah, I think you did it in 2 minutes.
I saw him eyeing the time, and I was like, oh, it's on.
Cool. Well, thank you so much for spending this time with me today to talk more about respiratory therapy and care. What I'm hearing is that it's the most important part of healthcare, and that people who are wanting to go into this field, really Boise State is the number one leader in the nation to help fulfill that. So I think maybe 30 seconds wrap up, if you guys just had any advice
He knows
that,
us.
that
He's
you
gonna
would
give us
give,
time limits.
yeah, any advice that you would give a student who's looking to go into the respiratory care field. And we'll start with Camille.
Oh, me? Okay. What advice would I give? I think ask for help. I think that is one of the best things that a student can do. I guess that's once they're in the field and in the program. But research it, look into it. There are our national organization, along with our credentialing body, has worked really hard to share what it is that a respiratory care practitioners do. And there are wonderful websites out there where you can explore the different roles that real people have taken out in the world. And so I think those are really wonderful resources for interested students to explore what their options are. Shout out to our team for our awesome Instagram page, because I think social media is a great way to connect with people. So follow us on social media. We share what it is that respiratory care practitioners do, both here in the Valley and out and about. So I guess research would be my advice.
And how would they follow us on social media?
What is it? Boise State Respiratory Care, at Boise State Respiratory Care. So, and we're also on Facebook, but I understand that's a little outdated.
Depending on the demographic, I'd say I would plug what Camille mentioned is just like any career that you're going to think about, research it. She mentioned that AARC has put out bnrt.com, and that's a great place to start. But come see us. You can call our office. You can call Robin Hood and schedule a time to sit down with one of the faculty. Get in touch with us. The advising office here in the College of Health Sciences is also amazing. So huge shout out to Olga and her team for all the work that they do. But they are wonderful in answering all the questions students have to ask and providing different parallel pathways. So you can, again, think holistically about what's the best way for you to pivot as a student given your interests.
Yeah, and reach out to us.
Yeah, we're good at email.
Yeah.
Texting. Don't call me, though.
Oh,
I'm just
please
kidding.
don't.
I'm a
can leave
millennial.
me-
I will not answer the phone unless
Yeah,
you leave a message.
You can leave me a voicemail and I'll email you back.
But no, in all seriousness, please get a hold of us. As you can tell, we love to talk about what we do, and we love to talk to potential students. So get a hold of us.
All right, sounds good. Thank you, guys.
Thank you.
Thank you for listening to Bronco Tales. Join us next month as we discuss body positivity and Boise State's Body Acceptance Week.
So my hot take, I think, is that body positivity is like such a great place to be, such a great place to like direct people, but it's still about bodies. And I'm a big proponent of like we're so much more than what our bodies look like. It's so much more than our bodies.